Good morning. My name is Olivia. I'm known as Olivia K on Facebook, Ollie K on Instagram, and Warmium 9800. On this channel, I go over NCLEX related tips that can help, or I go over materials that may help you with the NCLEX or even with nursing school exams. And on the side, I decompress and sometimes talk about reality TV shows. So I am going to do Temptation Island tomorrow, and I've already finished the Love is Blind series. So there's old playlists, you can check it out. So you have any needs for like any kind of fundamental tips, I have a playlist on that, and I do have a playlist on the Pharmacology series. This is going to be one of them. Today we're going to talk about psych meds, and it is very important for a person to know, whether you're a PN or RN, doesn't matter. You have to know these. You must, because it does test under psychosocial top subcategory in your NCLEX. So it is very imperative for you to know psych meds, as it can carry life-threatening consequences, and it does kind of test also on recognizing the cues. Okay, so there are plenty of psych meds, and most of these meds I have given in practice because I've told you before, I'm a home health nurse, and I see psych patients on a daily basis. So this is nothing new to me and whatnot. And I see some of these symptoms, but I've never seen any of those life-threatening ones that can sometimes be seen with certain patients. Because the thing with meds, they work differently on patients. That's just what it is. But you do see some symptoms with some of the patients. So it is important, and I mean it happens, so which is why people or rather NCLEX is testing the nurses to know these meds and why it's high yield. So I'm going to start up with SSRIs, and that's usually the first line of treatment for antidepressants because it does treat depression. And the examples are fluoxetine and sertraline, and I do administer those to different patients. Every patient's different. As I say, one size doesn't fit all. So it does take 4 to 6 weeks to work, and are normally administered in the morning because I've had to give the sertralins usually, and the fluoxetines usually in the morning, and usually it's like 15 milligrams for sertraline, and then the fluoxetine is usually 80, so 2 caps. So every patient's different. So I need you to star or underline. So anytime I say star or underline, it's a need to know. So this part is what I'm about to say. It's a need to know. You're going to monitor for SI, or what I like to call suicide ideation. And that's what I do with most of my patients who are prone to decompensate, because I do have, again, I take care of psych patients on my job on a daily basis, and that's something I always assess every single day. You must assess for that. Monitor for serotonin syndrome. This I have never kind of seen in my life. I've never seen anyone suffer from this. The whole time I've taken care of psych patients for as long as I have, but it has happened. So which is why it's important that it needs to be covered. So the signs of symptoms you can see is agitation, sweating, fever, and also etc. Well, those are 3 known that they're saying. So you want to make sure this patient does not stop this med. It cannot abruptly not be taken. Very important that they take this. Avoid alcohol. Avoid St. John's wort. That herb is important to know because it cannot interact with many medications, especially Coumadin, increased bleeding, precautions for that. So you want to be careful with St. John's wort if they're taking herbs. And if this is being DC'd, I need you to start this especially. Do not give MAOIs. So your example will be your phenelzine, because this is going to be life-threatening for them. And they can get into what's called hypertensive crisis. So I'm going to cover that when I talk about MAOIs. Okay, so that brings me to MAOIs. So it's not commonly administered these days. It's very rarely administered because of the fact that it has a lot of restrictions to it, which I'm going to go over. And like I said, it can cause hypertensive crisis if you eat the wrong food. So let me give you the list, okay? So you want to avoid pepperoni pizza, for example. So pepperoni, because that's kind of smoked meat. Anchovies. I don't know anyone who has anchovies on pizza, but we want to avoid that. Aged cheese. So those are like your hard cheeses. So like Gouda, which I have in the fridge and they're so yummy. I haven't had them on a whole weight loss. I haven't eaten them in a while. So shame on me. Extra sharp cheddar cheese. So those are the ones, like if you go to market, like say Stop and Shop or Market Basket, you'll see the hardened cheese on a block. Those patients can have that, but like it's like soft cheese, like I don't know, not Swish, but like the processed cheese that you would like put on your cheeseburger, that's okay, but each ones are the ones where you want to avoid. Smoked meats, as I was just saying, jerky, and then don't eat hot dogs, fermented foods like kimchi and pickles, and overly ripe bananas. So you have to unfortunately eat, if you want banana, you have to eat the green and barely yellow kind of bananas, because that's not good. Avocados, I'm not really a fan of avocado anyway, but you can have avocados, so no guacamole for you. No prunes, no raisins. And as I mentioned before you're going to start a patient on SSRIs, or even vice versa with MAOs, you want to keep them 2 weeks before they are taking it, because again, it could cause a hypertensive emergency or hypertensive crisis. So you need to wait 2 weeks in between. Okay, so SNRIs, so that's another antidepressant, and you can also treat it for neuropathy pain. So the examples are venlafaxine. I'm so sorry, I'm really horrible with saying some of these generic names. Ugh, I gotta get more practice. I'm trying to be a psych prescriber one day, so I really need to up my pronunciation with words. Okay, and then duloxetine, so which I have given that many times. So you check the blood pressure because it can cause hypertension. You want to monitor for creatinine, BUN, and ALT, AST. So you'll recognize that those are your liver and kidney function. So monitor those when you're giving this medication. So the next thing I'm going to talk about too is TCA, and I have given like one of them before. So that's amitriptyline, nortriptyline. Those are your examples. So they are anticholinergic. So I have one memory trick for you to remember. So when you're thinking of anticholinergic, it's drying out. So say you're really dehydrated, you're dried out like a well, right? Because the well doesn't have water in. So the symptoms that will occur would be your dry mouth, constipation, urinary tension. So because there's no fluid, right? Or it's holding on to, or it's not so much holding on, there's just none. So you're all dried out like a well. So hope that helps you. So I need you to start underline TCA, which I don't think I've seen it be given for a while, but I've only given like maybe once or twice in my career. You want to monitor the EKG. Why? Because it is cardiotoxic, and especially if this patient will OD, because it's easy for a patient to OD on this. So, which is why you need to avoid giving this for patients that have suicide ideation or suicidal thoughts. So you need to be careful, because a patient can take that and then they can easily OD and kaput. Okay. Then we have the antipsychotics. So I thought I was going to just just going to be 2 parts, but never mind. I guess I can fit this in all one video. Okay, so antipsychotics. So you have 2 different types. Your typical, that's the first generation, and then your atypical. The typical one, I'm going to need you to start and underline this one as well. And these are the ones I actually do still give every day on a daily basis. So your typical examples will be your haloperidol. I know that's Haldol, chlorpromazine, promazine as it's marketed. So they treat psychosis, as I said, it's antipsychotic. Patients can have what's called EPS, which I have seen symptom of it once or twice. Tardive dyskinesia. I have seen that with my patients, and I don't point it out. I can tell because I can see it on them, and unfortunately that's the symptoms it carries. And you can normally give like benzotropine, or I call cogentin as well. That's the other name for it. And I think my patient is on some other medication. I forgot the name for it. And I'm not going to give out names, by the way, but he's also on another medication that also helps with that as well. They can also have what's called dystonia, so that's your neck spasms. Now this one is an underline and star, so please underline or star whatever way you can get this in your brain. Monitor for NMS, so that's neuroleptic Malian syndrome. Okay, so that's symptoms that can occur with this is fever, rigidity, confusion, and once you see that, or especially confusion, stop that medication. Which again, I've never really seen this in my practice in home health, but again, this happens. So this is why I have to go over this, and it's important for you to know for the exam. But I've never seen this happen in my life, but it has happened before. So if this happens, stop the medication, and this patient needs to go to the hospital like today. Okay, so then I'm going to go over atypical, and these I do still give to on a daily basis. I still give them every single day. So I recognize half these meds because this is what I give to my patients all the time. So again, true psychosis is atypical. This is 2nd generation. It may cause weight gain in the patients because they'll have what's called metabolic syndrome. So it's high, so which will be your high cholesterol, high blood pressure, high glucose. It just happens. So I need you to put a star and underline with clozapine. Sorry, don't confuse with clonazepam and Klonopin. By the way, it's clozapine. Okay, I need to get that right. So you know what I'm saying, okay? This is, so I say this because I see this with my patient all the time, and I always ask him if he goes and gets tested, because he does have to get tested every so often because he's on this medication. So you need to monitor for CBCs regularly. This is very important. So you want to watch out for fevers and jazz like that. Why? Because it's going to cause low white blood cells. So my patient has to be always checked regularly before I can call in for a refill, and I do always follow up, and he always goes and gets his labs done. So make sure you do that for your patient, or make sure when you see in a question and they ask you if the patient has a fever, just know it may have something to do with clozapine and them not getting it checked. So I'm going to go over lithium, which I always do give as well. Most of these meds I have given. Lithium, I have like at least 5 patients on this. 4 or 5 of them are on lithium. They're mood stabilizers. And the therapeutic level, I need you to star and underline this part. Therapeutic level is 0.6 to 1.2. And over 1.5 is going to indicate toxicity. Sorry about that. So your signs and symptoms can include tremor, confusion, vomiting. So once that happens, notify the prescriber or have them call a clinic because their levels need to be checked and whatnot. And the patient needs to be hydrated when they're taking this medication, and they have to have an adequate, maintain an adequate amount of salt when they're taking this. So absolutely no diuretics whatsoever, no spironolactone, no Lasix, none of that. Okay. And the very last one I'm going to talk about, actually going to add one more bonus here, benzodiazepine. What's wrong with me? My God. I need to learn to words because I'm going to be one day a psych nurse psych practitioner, and I need to understand how to pronounce. Oh, I am very bad at doing that. Okay, so I have given Advent, that's the brand name, lorazepam many times. Diazepam not as much. So it treats anxieties and anti-anxiety. The biggest thing against STAR and underline is monitor for respiratory depression, because these medications have a high risk of addiction, and if a patient's not careful, their respiratory their respirations will tank. So your antidote, when you see this in a question, you want to choose administer flumazenol. Man, I need to stop. Sorry if I'm fluking on the words. Flumazenol. Okay, so that's your antidote. So this also happens with what's called opioids, and we're going to go over that. That's going to be my next high yield. I thought this was going to be my last, but I think it's important we go over pain medications as well. So I'll do that for my next pharmacology video. I'm going to add one more bonus. They may not even ask that, but I just threw it in anyways. So that's your ADHD, methylphenidate, and this lowers appetite. So this is mostly given with children, teenagers. So in case you get a question like this, it lowers your appetite, and it can cause insomnia and gross depression. So which is why it's important that it's given in the morning, because of the insomnia. So, okay, those are the meds, psych meds that need to know. And I will definitely go over pain meds. I think this is very important to go over. And I'm trying to think if there's one or two other high yield meds that it's important for you to know. But definitely psych was very important. So again, don't mind the pronunciation. I'm sorry. But I'll leave some links on there. Mark Hay. So with the Mark Hay, I don't give the sources out anymore. I don't message people and then send it out, because I'm really here to try to help you get pointers. And as I said many videos ago, sources alone is not going to help you pass the NCLEX. It's connecting the dots and using the source as a tool in order to apply it to a question. Because that's how I had to learn. And that's what happened the first time when I failed, because I relied on sources rather than taking the information that is being given and applying it to questions. So if you want to succeed, it is important to take the tools of what is being presented and then applying it, because they're not just going to straight up ask you what is this and what is that and what medication is this is going to be used to stop this complication. You have to apply it when it's in the choices and what's being presented in the questions or case studies or bow tie. So that's why. So I will leave the link there. And if you want to look for Mark Hay lectures, go on Reddit. And I know if you search Mark Hay lectures, they will have a file of Mark Hay lectures. And you'd have to have what's called Google Drives, and it'll show up there. Then I'm going to leave Simple Nursing. He does so good with psych meds. That's another good source too, in case you didn't get anything out of it. I hope you got a lot out of this, because it's leaving me all winded, and I'm starting to get a little better talking in front of camera now, which I love. And then I'm going to leave Pixarize and Picnomics in case you want to be able to get an account with those, and then you can look through. And I believe with Pixarize, they do have some videos on YouTube for free that you can look and study off. Okay, so I'll leave those links below. I'm going to do Temptation Island tomorrow, because I'm not paying for my Netflix today, and I'm going to get that done tomorrow night, or maybe tomorrow in the day, depending. And I'll go over pain medications maybe Friday. I may not have time, or I know this weekend I won't have time because I'm working, and I'm not going to see the Michael Jackson video. So let me know you're going to watch the movie this weekend. I didn't hear some good things, but it's good. Okay, and I will do the pain ones on Monday. Okay, take care and have a good one. Bye now.